Hello, dear viewer. I welcome you to Family Health and Life TV. Thank you very much for your feedbacks on our previous videos. They are highly encouraging. Thank you very much. Today, we'll be discussing on how to use lemons to relieve dysmenorrhea. How to use lemon to relieve dysmenorrhea. Yes, we are still on lemons. There is a whole lot to be learned from lemons. So today we want to see how we can use lemon to relieve dysmenorrhea. Okay, so dysmenorrhea is just the medical term for painful menstruation. I know ladies relate more to that. Painful menstruation, painful menstrual cycle that results from uterine contractions. So in just the shortest and simplest form of it, dysmenorrhea is just painful menstruation or painful menses, whichever is more convenient for you. Oh, well, it's important for us to know that there are two types of dysmenorrhea. We have the primary dysmenorrhea and we have the secondary dysmenorrhea. This distinction is highly important so that we can understand what is going on in our bodies and we can be able to really know what to do to tackle. It's important we know these two types because this knowledge will guide our further action. Okay, for primary dysmenorrhea, we can refer to it as a painful menstruation in women of reproductive ages. Those who have attained puberty and they have started their monthly menstrual flow. So, they are with normal pelvic anatomy. I'll break it down. I said they are with normal pelvic anatomy. That is, such women do not have any other underlying disease. Any reproductive disease. They are fine. They are perfectly okay. But they still experience that kind of pain. They still experience that kind of painful menstruation. So that is primary. And this primary dysmenorrhea commences or shortly after the onset of a woman's first menstruation. For example, maybe a young girl that starts her menstruation at the age of maybe 11, 12, 13, thereabouts. So that is menarche. That is the onset of the first menstruation ever that such a girl will experience or have. So this primary dysmenorrhea commences at or shortly after the onset of a woman's first menstruation. So, or shortly after it, like let's say 6 to 12 months after. If it doesn't start immediately, the young girl starts her menstruation, then it can commence 6 months to 12 months after the commencement of the first menstruation. Do you understand? Okay, thank you. So for secondary dysmenorrhea, that's the second type now. The secondary dysmenorrhea, this is a painful menstruation in women of reproductive age with specific pelvic pathology. These women have they have some underlying diseases. So secondary dysmenorrhea can be pointing to several disorders in women. And such disorders can include endometriosis, pelvic inflammatory disease, infertility problems, and a whole lot of them. And that is why I said it is important we know these types of dysmenorrhea, and let us know how each of them appear so that a young lady, a young woman who is experiencing dysmenorrhea doesn't just categorize everything as, oh, I'm just having painful menstruation. Just anytime I want to do my menses is always with pain. We should not just generalize them. We need to have this understanding as a woman. All right, so how can a woman then know which of these types of dysmenorrhea she's experiencing? How can a woman know, that, okay, this is a type that I'm having, number one that I would suggest here is that she can track the time when this dysmenorrhea commenced. When did you start feeling the pain? That each time you want to do your menstruation, when did this pain actually commence? When did it commence? From the explanation of the primary dysmenorrhea that we said that one can start immediately. A lady or a young girl is starting her first menstrual cycle. The pain can start along with it, or shortly after, like 6 months to 12 months after the very first menstruation. So that one is still under the primary dysmenorrhea. Do we understand? So when the time your pain starts could be a pointer to what kind of the type of dysmenorrhea you are experiencing. And for someone who starts to feel the pain when maybe some years after you've been having very smooth menstruation all along, you've been having smooth menstrual cycles, but just suddenly after several years, you just begin to feel the pain that wasn't there in the first place, then that can be a pointer that you could be having a secondary dysmenorrhea. And the second way that a woman can use to determine which of the types of dysmenorrhea she's having is, by going to the hospital to be properly and thoroughly checked. I will tell you why. We may feel, just because I'm on my cycle, I will now be visiting the hospital and be telling them I'm having menstrual pain. Is it not just ordinary menstrual pain? No, it is not just ordinary menstrual pain. Because of the factors that we said could affect or could be the cause of the secondary dysmenorrhea. We said secondary dysmenorrhea needs to be further investigated. Do we understand? Secondary dysmenorrhea needs to be further investigated at the hospital so that the exact cause is identified and treated properly. Are we getting it? So that they will know what really is the problem. Where is it coming from? An untreated or a left alone disease can develop into something bigger. So we should always be. Hospital is not a dreadful place to go. We should always go there to seek help when we need it. Okay. Now, for primary dysmenorrhea, several studies have been conducted. Also for secondary dysmenorrhea, for all the types of dysmenorrhea, studies have been conducted. But now I am on primary dysmenorrhea. For primary dysmenorrhea, several studies have been conducted, yes, and a Cochrane review of 73 randomized control trials, we call them RCTs, demonstrated strong evidence to support non-steroidal anti-inflammatory drugs, NSAIDs. All these drugs, anti-inflammatory drugs, non-steroidal, as the first-line treatment for primary dysmenorrhea. Why? Because this dysmenorrhea is not as a result of any underlying disease. It's just a pain because of the contraction of the uterus, the uterine contractions that take place at interval. We call menstruation the bleeding of the uterus. The bleeding of the uterus. That's another name for menstruation. When there is no fertilization and no sperm is coming to the egg, what happens is the egg is shed, and at that point, there is a contraction. So this contraction could normally cause a mild pain. So if it is primary dysmenorrhea, it's just a normal pain, that doesn't need any alarm to be blown because of it. It's just a normal pain. And so these NSAIDs, the non-steroidal anti-inflammatory drugs, can just be used as a first-line treatment for primary dysmenorrhea. Okay, so now, this is where our dear lemons, come into action. This is where our dear lemons come into action. It's a solution because lemons are anti-inflammatory fruits. They are anti-inflammatory citrus. From the studies of some group of researchers such as Azat 2000, Lucia and George 2009, several studies, they've said that lemon is one of the species of citrus that have a broad spectrum of biological activities such as antibacterial, antiviral, antioxidants, and anti-inflammatory, analgesic, antifungal, and anti-inflammatory. They are anti-inflammatory in nature because they contain citric acid and all that. Do you understand? So they naturally help to relieve pain and swellings, or inflammation. All right, so how then do we use lemons to relieve primary dysmenorrhea? How then do we use lemon to relieve primary dysmenorrhea? All right, just like our normal way, get your 2 lemon fruits. Just get like 2 lemon fruits. When you get them, juice the lemon fruit rather, into a cup of cold water. I'll tell you, normally cold water relieves pain. Do we understand? So when you go for immunization for your baby and the baby is given an injection and there is a swelling at that point of injection, the first thing to do on that kind of on that leg or any part where that baby has been given injection and there is a swelling, the first thing to do is get your ice pack. Get your ice pack and place on the point of that injection, or where the swelling is. So cold water or ice pack, the coldness brings a sort of relief of pain. So you can see double action. Lemon into cold water. So it's very effective. It's very effective to reduce, and to relieve pain. So what you do is you juice 2 lemons into a cup of cold water and you drink it. You drink it 1 or 2 days before the anticipated onset of your menstruation. For example, if your menstruation is meant to start, let's say tomorrow, you can start to take this lemon juice from yesterday. From yesterday morning, you can try to start the therapy. So you take it, 2 to 3 days before your anticipated onset of menstruation. Then you continue it on a fixed schedule, like maybe every morning. I will advise every morning before you take your breakfast. So let this therapy be repeated. Then you can do an assessment of your improvement every 6 months. Wow. And I'm sure you will have a positive response to give. Okay. So let's go to the caution about this therapy. The caution about this therapy, as good as it is, very good. Lemons are wonderful and you can achieve a lot with them, like we have mentioned. But since lemons are rich in citric acid, then there is a tendency for tooth enamel decay. Every citrus fruit, every fruit that has citric acid could possibly give tooth enamel decay. So, but not to worry. Just ensure that after each consumption of lemon juice, your teeth are thoroughly washed. After each consumption, and you are good to go. And you are just so good to go. So also, I would like to suggest that ensure that you are free from acid reflux. Ensure you are not suffering from acid reflux before you embark on lemon juice therapy. before you embark on lemon juice therapy. This is because acid tends to worsen the case of acid reflux. Okay, the term is getting so big. What is acid reflux? Okay, we'll get to there. Acid reflux is just a digestive disease condition in which some acid containing contents in your stomach, persistently leak back up into your esophagus. That is acid reflux. That is acid reflux, and sometimes can cause heartburns, bloating, and a whole lot of those symptoms. So if you know you are suffering from acid reflux, please make sure you are free from heat before you embark on the lemon juice therapy, so it doesn't worsen your condition. Then if you are suffering from maybe mouth sores or something like that, ulcers in the mouth, please don't take the lemon juice at that time, so that it doesn't, ulcers generally don't like anything acidic, and lemon juices are acidic because of the citric acid content. So please, you can desist from lemon juice during the periods of those conditions. But after you are free from them, please, you are good to go to take them. So once these cases are settled, friend, you are good to go with lemon juice therapy for relieving your primary dysmenorrhea. Okay, so let me just conclude this by saying that more attention should be drawn to the issue of dysmenorrhea in women. It should not be taken with levity, it should not be taken lightly anymore, so we can have more productive and happy women in the society. There is a saying that behind every successful man there is a woman. We need women in our society. We need them fit, agile. We need them, on their toes, so that they can contribute positively to the society. We do not want women who are depressed because of pain. We do not want women who have lost their self-esteem because they feel maybe at the time when they are meant to be productive, that's when dysmenorrhea sets in, and so their self-esteem is being tampered with. So let's settle the issue of dysmenorrhea once and for all. Let's join force. Let's join hands. Let's join hands and see to it that dysmenorrhea becomes a thing of the past. Yeah, so dysmenorrhea becomes a thing of the past. Okay, before we finally end our lecture on or our discussion on the health benefit of lemons, I would like to finally note that the following cautions must be taken when you are using lemon, in addition to what I've mentioned earlier about having acid reflux, about having mouth sores or mouth ulcers, and about now I would just like to add that if your intention is to use lemons to get a very smooth face, fair face, you use lemon or you apply lemon juice to any part of your skin, face, or any part of your skin that can be directly exposed to sun or to sunlight, sun rays, and all that, I will implore you that you should not walk under the sun immediately you apply them. This is because there is something that lemon contains. It's called sorrels, and it relates with the sun to cause burn. There can be the issue of sunburns and all that, and so we don't want to leave you, worse than you were. So if you just apply lemon, you can stay indoors for like an hour or an hour 30 minutes before you proceed to do your daily activities. And that is why we always recommend that should be done maybe early in the morning or when you are back from your work in the evening, so everywhere is cool, calm, and you can enjoy your therapies. Okay, so thank you very much for your time. I do hope you have gained one or two lessons or one or two things from this video. Your feedback is highly important to us to serve you better. Always encourage more people to visit our channel. You can catch up on our previous videos, and you can also share the link with them so that they can also be partakers of the good thing that is happening on this channel. So till we bring more videos away, please keep being healthy, keep being fit, and invest properly and well in your health. Thank you very much, and bye.